Good afternoon, one and all. Today I am here to present a case about cavernous hemangioma of the orbit. The most common intracoronal benign orbital pathological lesion in adults is a cavernous venous malformation, accounting for 5 to 9% of all orbital tumors. Orbital cavernous venous malformation, previously known as cavernous hemangiomas, are benign, non-infiltrative, slowly progressive vascular neoplasm composed of endothelial lined spaces surrounded by fibrous capsule. Most CVMs are located in the muscle cone and in the area of the lateral wall of the orbit with progressive enlargement of thin-walled vascular channels, which leads to clinical symptoms. Chief complaints: a 51-year-old male patient presented with a painless, anterolaterally rapidly growing orbital proptosis of 30 mm in size in the right eye over 1 month duration with exposure keratitis. And the patient complains of rapidly progressive, painless loss of vision in right eye since 30 days with protrusion of eyeball along with lid retraction. Patient is unable to close the eyelid completely, for which exposure of conjunctiva and cornea along with redness and watering of eye occurs. History of past illness: no significant history. Personal history: cigarette smoking and alcohol consumption since 30 years. And history of trauma to right eye 3 years back and 3 sutures applied to eyebrow. And here is the patient with proptosis. On general examination, patient is moderately built and moderately nourished. Ocular examination: uncorrected visual acuity, right eye perception of light negative and left eye 6/6. Anterior segment right eye, upper eyelid retraction present, congestion present, exposure keratitis present, and anterior chamber, iris, pupils, lens obscure. Left eye normal. On CT orbit, intraconal right orbital mass with mass effect causing proptosis consistent with cavernous malformation, and with differential diagnosis schwannoma, non-specific orbital inflammation like pseudotumor cerebri involving superior rectus muscle, bilateral maxillary sinusitis. Treatment: patient underwent right eye enucleation with tumor excision. Histopathological report: cut surface of soft tissue cystic, firm with grey white areas. Section studied from the eyeball shows a lesional component composing of large dilated vascular spaces lined by flat endothelium filled with hemorrhage and separated by thin fibrous septa. Conclusion: surgical resection is always indicated in symptomatic patients. The aim of surgical treatment is total removal of tumor while at the same time preserving the optic nerve and muscular structures as much as possible. Thank you.